What antibiotics are used to cure H. pylori ulcers? Imagine battling a tiny but stubborn bacteria that can cause painful stomach ulcers. That's what treating Helicobacter pylori involves. To effectively eliminate this bacteria, doctors use a combination of antibiotics along with medications that reduce stomach acid. The goal is to eradicate the bacteria and help the ulcer heal completely. The main antibiotics used include clarithromycin, amoxicillin, metronidazole, tetracycline, and sometimes rifabutin. These are not used alone but in specific combinations to improve success and prevent bacteria from becoming resistant. One common approach is called standard triple therapy. This involves taking a proton pump inhibitor, which lowers stomach acid, along with two antibiotics. Usually, clarithromycin and amoxicillin are prescribed for about 7 to 14 days. If a patient is allergic to penicillin, metronidazole replaces amoxicillin. The acid reduction helps the antibiotics work better and speeds up healing. However, resistance to clarithromycin has increased in many parts of the world, making this treatment less effective in some areas. When resistance is high, doctors might extend the treatment to 14 days and use higher doses of the acid-reducing medication. Another widely used regimen is bismuth quadruple therapy. This is often recommended when clarithromycin resistance is a concern. It combines a proton pump inhibitor, bismuth subsalicylate, tetracycline, and a nitroimidazole antibiotic like metronidazole or tinidazole. This treatment lasts for about 14 days and has been shown to achieve eradication rates above 90%. Bismuth helps by coating the ulcer and killing bacteria directly. If initial treatments fail, this quadruple therapy can be used again as a second option. There are also other options for stubborn cases. Levofloxacin-based triple therapy or rifabutin-based triple therapy may be used after previous treatments don't work. Recently, new drugs like vonoprazan, which is a potassium-competitive acid blocker, combined with antibiotics such as amoxicillin and metronidazole, have shown promising results in improving eradication rates. Choosing the right antibiotics depends on local resistance patterns, patient allergies, and prior antibiotic use. Always, acid suppression with a proton pump inhibitor or vonoprazan is essential to help heal the ulcer and make antibiotics more effective. After completing treatment, doctors recommend testing again, at least for weeks later, to confirm the bacteria are gone. If the first treatment doesn't work, alternative antibiotic combinations based on susceptibility testing or local guidelines are advised. In summary, the main antibiotics used to treat H. pylori ulcers are clarithromycin, amoxicillin, metronidazole, tetracycline, and sometimes rifabutin. These are combined with acid-reducing medications and sometimes bismuth. The choice of regimen depends on resistance patterns and individual factors, with bismuth quadruple therapy becoming more common due to rising clarithromycin resistance. Proper combination and duration of treatment are key to successfully eradicating the bacteria and allowing the ulcer to heal. Always consult your healthcare provider for personalized advice and follow-up testing to ensure the bacteria are fully gone.